The global insurance industry is more than a market.
It's a movement powered by 3 million professionals around the world.
Together, we support communities as they rebuild after disaster.
Help businesses through risk and uncertainty.
Protect individuals as they plan for brighter futures.
This impact isn't possible without people.
That's why we attract, grow, and retain the very best talent.
Because when every voice is heard,
When every person feels they belong.
We don't just build careers.
We build a better tomorrow.
Belonging builds tomorrow.
Belonging builds tomorrow.
Belonging builds tomorrow.
Belonging builds tomorrow.
Belonging builds
Belonging builds
Belonging builds tomorrow.
Good morning. Thank you to everyone joining us. Thank you to everyone who's on Teams, Zoom, etc., whatever platform that you're joining us today for this incredible, very important session that we're having. My name is Alexis Simmons. I am the moderator for today's panel. Our topic today is family caregiving. Caregiver Compass, Navigating Family, Work, and Well-Being. So what we're going to do is give an overview of dive in. We're going to talk about caregiving, the definition of what caregiving is, and introduce you to our panelists. So just a little about Dive In. The Dive In Festival is a global event that's dedicated to promoting culture, talent, mental health, in all different spaces of the insurance sector. We're in our 11th year, and Dive In continues to bring together industry leaders, professionals, all from around the world. They prioritize mental health, talent, driving innovation, resilient, and more. So what's caregiving, right? Caregiving is a person who gives care to people who need help taking care of themselves. While we pick up, caregiving can include children, the elderly, patients who have chronic illnesses or are disabled. Caregivers can be health professionals, insurance professionals, friends, family, social workers, or more. They can give care at home or in a hospital or other settings. And I will close us out with just one quick quote, or stat rather, more importantly, that there are over 53 million people providing unpaid care in the US in 2020, according to AARP. So right now I'm going to introduce our lovely panelists. We have Jessi Hinkley at Marsh McLennan Agency, Fela Abioye, who is the Managing Director of the Hartford, Lauren Chowdhury, our Senior People Partner at Marsh, and my Georgia Peach, I like to call her Dr. Izzy, who's a counselor and a member of NAMI. So we're going to get started, jump into our first question, and this is going to be for Lauren and Jessi. So being a caregiver while balancing family, work, and personal well-being is difficult. If you can just introduce yourselves and share your experiences as caregivers.
Sure. Do you want me to go first?
Yes.
Okay.
Let's hear from you.
Good morning, everybody. I'm Lauren Chowdhury. I work at Marsh McLennan. I've been working here about 22 years. I have been in the insurance industry over 30 years. I live in New Jersey. I'm a married mom of 4 kids and a very anxious golden doodle who I adopted a few years ago. I have 2 kids in college and 2 kids in school at home. My role as a caregiver, beyond that of my children and I guess my husband, started about 5 years ago when my mom was diagnosed with Parkinson's. And within a year of her diagnosis, she had a series of small strokes, which led to a bunch of extended stays in hospitals and rehabs. And eventually we had to move her into an assisted living. I have a pretty small extended family. It's just my mom, my brother, and I. And he lives a couple of hours away. My mom lived down the road from me. So my role as a daughter quickly morphed into like all kinds of roles I literally wasn't prepared for. I became her healthcare proxy, her healthcare advocate. I became her power of attorney. I do all of her bills and banking. I became her driver, her scheduler, her personal assistant. I manage all of her doctor's appointments, all of her medications, and all of the coordination with Medicare and Medicaid, which is super complicated. I never really feel on top of her healthcare. It's just 1 week, 1 month at a time. That's sort of how we try to approach it. And I would say that overall, one of the hard things about being a caregiver in this particular situation is there's really no checklist for how to go about this. So it's been a bit challenging to learn as you go. It's not what I would recommend in this scenario. And it has caused my husband and I to give a lot of thought to our own care later in life and how to alleviate some of that for our own children.
I think that's a great point because my mother has sickle cell, and sometimes I feel as though maybe I'm not doing enough, or, could I address certain things? There is no checklist, like you said. So I love that thought. And Jessi, I'm going to turn this over to you as well. If you could just share your experience as a caregiver, your role in supporting a loved one and how you've been navigating that.
Yeah, absolutely. I'm Jessi Hinkley. I've been with Marsh McLennan Agency almost 4 years. I'm a single mom of two, one, as she says, practice adulting, and one teenager at home. My caregiving experience, my role, my everything was most of last year helping my mom take care of my grandma who was battling cancer. I drove 200 miles round trip every week, 4 days a week down in Wyoming, 3 days a week at home in Montana. I worked from her house while my duties included the basics, cooking, cleaning, but it also included bathroom duties. I helped her shower. I dressed her. I was the only one that she would let clip her toenails, and they were a thing because with chemotherapy, she had neuropathy of her feet. She said it always felt like she had steak knives jabbing in her feet. And so just to handle her feet was a feat. But it was a long year of back and forth. And like Lauren said, it's week to week, month to month, but really it's day to day.
Yeah. And that's all we can do is day to day. I tell you both are my heroes, seriously. I want to transfer over in here from Fela. Now, your experience and your background is very interesting. You're one of my favorite girl dads. This question, what challenges have you faced in balancing your caregiver responsibilities and your personal life as a working parent?
Yeah, no, I appreciate the question. And first, experience through fatherhood. And so I've got two young daughters, and I'd been married for many, many years prior to, and many people told me often that, man, everything changes after you have kids. Everything changes. And man, they weren't lying, right? So
Yes.
it's just a different ball game, right? And so every single thing that they do, the time that they wake up, eating, diapers, sleeping, right? All the things while still having to find the capacity to take care of yourself and take care of your own mental state. It can be, you can get lost in that, right? You can get lost in parenthood. You can get lost in really just being a mom, being a dad, right? But it's very much a temporary state. And, if all things go well, they're supposed to go off and do their own thing after a while. And then you're kind of left with this life you've experienced. And so it's been an adjustment period, I would say, over the last a few years, and one child is one thing, and then you add two, then it's a whole other thing, right? And kudos to all the single moms and single parents out there, because I personally, I don't know how in the world you do it, right? I've got a two parent household, and it's a struggle, right? Even with four hands, right? So again, big ups to all the single parents out there. And so um the big thing for me that I recognize, that though this time is challenging, and yes, it can be very difficult and very stressful, but very, very necessary. And so, because it is temporary, and that's the big thing that I always have to continue to remind myself, and how important and how vital this time is, um, especially, being a father. A lot of cultural references will say that you're supposed to be the provider. You're supposed to be the person that helps provide and do all the things. And so I've tried to keep that in mind, but I also felt like it's important that I'm present, right? And so my time and the energy that I spend with them, right, is what's more valuable, honestly, to me than even just money. And so showing up every day, being present in all aspects of their life, right? And so, and being super vital to that point is how I try to manage that.
No, that's a really great point. And I think, I can share your sentiments. I may not be married or in a two-person household. I said to myself this morning while I'm getting sass from my 13-year-old, I wish I was married. I'm a single parent as well, Jessi, of three kids. I have a 13-year-old, a 3-year-old, and a 2-year-old, and it's really hard. And, I think we can all agree, none of us ever imagined ourselves in this role, whether you're single, married, caregiving, it sort of happens. So, but they say God works in mysterious ways. For some, that's your caregiving for your grandmother, your mother, etc., a friend. Help is wanted, it's needed, and we're stepping up, whether we're parenting our parents or parenting our children. So what we're going to do now is we're going to move on to one more question for our panelists that I think is important, and I'm going to circle back to Lauren and Jessi. So this one is for both of you, that I think is important. So despite the challenges that many caregivers face, how do you find moments of joy or fulfillment in your role? And if you can just share a particular experience or an aspect of caregiving that brings you a sense of joy or purpose.
Sure. I had the benefit of Alexis providing this question in advance, so I did give it a lot of thought. And I'm going to be honest, it's kind of hard to find joy right now with a chronically ill parent and household to balance. So I think I'm still waiting for the universe to kind of show me my grand lesson and what the meaning of a lot of this is. Right. But I will say this, I'm very grateful for like an amazing husband and a great work family. Like I have the best work colleagues who are super, super, super supportive, which is why I've been here 22 years. So very thankful to have that support in my life. So that does bring me a sense of joy. I would say that my mom is super appreciative. Like rarely a day goes by that she doesn't thank me for my help, for my support. I know that she's scared. I know that she's lonely. So like, I think that's where I take some solace. I guess I don't know that I would call this joy yet. I sort of waiting for that big reveal.
And that's okay too.
But I would say that, being able to give back to my mom and be able to take strength from, the people around me have been the positives out of this.
I appreciate that, and I appreciate you answering. Jessi, if you need me to repeat, I can. Do you want me to repeat the question? It's a mouthful. I know.
I think I've got this. This was
okay.
When you provided the questions originally, this one definitely spoke to me the most. I apologize in advance if I ugly cry because,
It's all right. We're doing this.
So as far as joy and fulfillment, one long story short, my grandma had been fighting cancer for about 6 years on and off. She had gone through multiple rounds of radiation, different treatments. This last time she started chemo, and the effects of chemo are just detrimental physically, emotionally, mentally, the works. Like I said before, she had neuropathy in her feet. She had no appetite whatsoever. If something did sound good, she had no taste. So then she went to eat it and it just wasn't the fulfillment that she needed. And there were days where she just had bad days. And on my days off, my mom's best friends would come help and take care of her on those days. And God love them. We thank them every day for their help, but they were far too positive for my grandma's liking. And of course, we always want to stay positive and whatever, but my grandma would say, "Oh, I'm just having a bad day and this hurts and I don't feel good and this, that." And they would come in and say, "No, you got to think positive. You got to, find the happiness in it." And my grandma would get
live, laugh,
so
laugh.
mad. She would shut down. She would just be quiet for the rest of the day. I would come back on my days and say, "Well, what's up today?" Or I would try to turn it into, "What'd you watch on TV today?" Because how do you ask a person who is dying, actively dying, and knows that their days are only going to get worse every day? How do you go into their house and say, "How are you?" Because she would say, "I'm dying. It's not going to get any better." And so my biggest peace, joy, fulfillment out of taking care of my grandma was letting her feel all of her feelings. I would say, "Let it out. Tell me." She did that for me my whole life. And so the biggest thing I could do in her ending days was to let her feel her feelings, to let her just be okay, accepting that she was going to die, that her days were not going to be joyful because she was in pain, she was sick, all the ailments that went with cancer and actively dying, but just to feel everything that she wanted to. And I'm hoping that by joining with this panel, by sharing with all of you amazing people out there, to remember that we're not in those people's shoes. We can't tell them how to feel. They get to feel how they feel.
Yes. I almost want to snap for that because it's a very powerful phrase. We're doing it. We're doing it. Thank you for including that. I hope it's okay that I kind of chuckle. I feel as if I were there with you, and I appreciate everything that you shared. So right now, we're going to move on to our next segment, and we're going to introduce Dr. Izzy. She is a licensed professional counselor based in Georgia. She's from New Jersey and has over 18 years of experience in community mental health counseling. She's developed her own expertise, clinical supervision, mentoring, and just so much more. So, Dr. Izzy, I think you've discovered, and from what you've heard, that caregiving, it can be exhausting. Sometimes there's no joy in that, and it can significantly impact a caregiver's physical and mental health. If you can just share your practices or your thoughts on what it's like being a caregiver or how people can help take care of themselves during caregiving.
Absolutely. And first, let me say thank you, Alexis, for inviting me to be a part of such an impactful and a powerful panel. And let me say thank you to all of the panelists who were vulnerable enough to share about your experiences, because again, we know that storytelling and sharing our experiences can go so far into helping so many people. So Alexis, I'm going to get to that question. But first, I really want to start out, I think, with a really, really powerful quote And you gave a beautiful definition of caregiving, but I really want to share this powerful quote with everyone here. And this is a quote from our late former First Lady, Rosalind Carter, former First Lady of the United States of America. She states, there are only 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, those who will need caregivers, and know that caregiving is universal. I just thought that that quote was so powerful coming from her, and to know that she was one of the first individuals to actually lead mental health legislation in our country, and knowing how important it is to support individuals' mental health. So I wanted to share that piece first. And then as we go kind of into a deep dive a little bit more about what we think about as it relates to caregiver mental health challenges, it's a variety of things that caregivers can go through. It can be mental, it can be emotional, it can be exhausting, it can be anxiety, it can be stress, it can be depression, it can even be a mixture of emotions, and not knowing from day to day how you're actually going to feel going through the process in being a caregiver. So I think it's first important to understand that there's really no way to necessarily describe it, that as you're a caregiver, your emotions can be very complex. What you're going through mentally can be very complex. And I believe being able to say that too is important, and being able to accept that is very important as well. And understanding that there are contributing factors to that. I did some interviews, and I'll share a little bit more about that in a minute, but I did some interviews, and one of the things that came up from the caregivers is that it depends on who you're caring for, whether it's an elderly person, whether it's a child, whether it's a person with terminal illness, whether it's a person that is a part of your family that you love. All of those challenges look very different. It could be that person may need disability. You may need to fight for them to get disability and supporting them and helping them. It could be challenges with getting that person mental health treatment. If it's a person with mental health needs, making sure they're getting the counseling, making sure they're getting the medications, making sure that there are resources. One of the caregivers that I interviewed is 70-something years old, and she's a grandparent parent, which we call kinship. She's raising her grandchild at 70-something years old. And one of the things she mentioned is going through this process is that there's been so many different levels of mental health challenges. She said, and some of the challenges you don't always think of as a challenge. And she said, so her granddaughter is a track star and had an injury where she injured her ACL. And so they were at home, and her granddaughter couldn't move, couldn't do anything because of the injury. And the injury needed to be iced every, certain amount of time, every few hours. She said, here I am, 70-something years old, running up and down stairs, trying to ice my granddaughter's injury. Then the next thing I know, my knees are hurting, they're failing because it's activating my, acting up my arthritis. She said, so before I know it, now here I am in a physical challenge. Here I am in a mental and emotional exhaustion, trying to care for my grandchild. She said, so then we start to look at resources and why resources are so important to caregivers. She said, so now I'm reaching out to the medical professionals. What can I do to help me? She said, and then they said, well, we have an icing machine, a machine that will actually do that for you. She said, now that was helpful to her, but the challenge is that insurance didn't cover that. So she had to pay out of pocket for that icing machine. But she said, I had no other choice because my knees were not going to allow me to keep running up and down the stairs to ice my granddaughter's injury. So again, the challenges can be very complex just depending on the caregiving in who you're taking care of. So I think it's very important that we know that as well, is that there's just a variety of different challenges that caregivers can go through depending on the person that they're caring for. And when we actually start to look at what some of those symptoms, I think, looks like, that's very important. When it comes to if a caregiver is experiencing depression, that can be in the form of having difficulty sleeping. That can be in the form of difficulty with your eating habits, whether that's overeating, not eating enough. That could be issues even with body aches, having headaches, pains in certain places, having digestive issues, and you're trying to figure out where's irritable bowel syndrome coming from all of a sudden. And sometimes it's related to stress, and even depression. Different things that we can go through. So again, the symptoms, they vary up and down based upon where your emotions are at that particular time. So those are just some of the commonalities and some of the challenges and the symptoms. But when we look at research that's out there, I think that's very important too. And there was a study that was done. But before I even share a little bit about that study, it said according to the Family Caregiver Alliance, about 20% of family caregivers experience depression. They said this is about twice the rate of depression in the general population. So I think it's important for us to, again, notice that, again, caregivers, as they're going through their challenges, they're also going through their own sometimes mental health anguish, which could be depression, and it could be anxiety, or it could just be a mixture of emotions. The study says, it was done in 2022, it says that it looked at 226 caregivers who were caring for individuals with dementia. And they found that 60% of those caregivers had depression at the start of the study. And 5 years later, all 60% of those caregivers still had depression with increased depressive symptoms. So again, it's letting us know that it's still even duration over time. Even if the person is no longer taking care of that person, or even if they're still taking care of that person, there are still mental health effects that are associated with that caregiver having those challenges and experiencing even the mental health related conditions and anguish all around caregiving. So that's what I have to share about the mental health piece and the anguish, but I'm going to go ahead and share just briefly about the interviews that I did, and then I'm going to get into some resources and some self-care tips. Did you want to add anything before I share that, Alexis?
No, go ahead. Take us to church.
Take us away. Absolutely. So I thought that this was really, really important because I wanted to add a personal touch to this actual talk that I'm sharing with you all today. So let me share with you who I did interview. I interviewed my mother, who is a professional caregiver and nurse. And my mother has been caregiving you all over 30 plus years, okay? My mother is 63. And again, she's been caregiving pretty much all of her life. So just like Alexis, pretty much, I'm telling you, she's my shero as it relates to being able to endure. But let me share with you a powerful quote that my mother shared in the interview. She said, "Caregiving is my passion. It's my gift. I enjoy being an advocate for people in need to ensure that they get the quality care that they need, as well as seeing some individuals live longer than they even thought that they would live." I thought that that was so, so powerful to hear my mother say, and being a caregiver for all that long. The second individual was a mentor of mine, the same one that I shared about, that is the kinship. She's the grandparent in caring for that child. This was the powerful quote that she shared. She said, "Counseling was a great support for me and my granddaughter." So she realized that going through counseling is what was going to help her to be able to cope with those challenges that we were talking about, and the mental health conditions and the anguish in being a caregiver, trying to go back and raise a child after all of these years. So counseling was her go-to for her and her granddaughter. The next individual was another mentor of mine that cared for her ill mother that had congestive heart failure. And she recently passed away this year, her mother did. But this was the quote she shared. She said, "It was important for me to maintain balance between caregiving and my personal life. So many times I would see her taking trips. She said, now, of course, that came from one of the resources we'll talk about, having a support system. She had a sister. She had other individuals that would give her relief while she was taking care of her mother. So again, that was a part of the balance that she was intentional about in working toward being a caregiver. She said, that's what helped me, I think, to keep my sanity and to keep me from not experiencing so many mental health related conditions as I could have experienced. So I thought that was powerful. And then the last person that I interviewed was actually my aunt, who has been caring for her spouse, okay, which is my uncle. And she shared a little bit about what her experience was. This was her first time ever being a caregiver. So she knew nothing about caregiving. So she said what was most important for her in combating the challenges and even some of the mental anguish was getting support. So again, her family support system played a huge role in her process in learning how to be a caregiver. She said, but now I can honestly say I'm a caregiver and I can go back and help someone else now. So look at how powerful, again, that is. Now, those were coming off from a woman's perspective. But again, these were still individuals who were caring for very different types of individuals and looking at some of the similarities too in some of their caregiving, I think was really important. So some of the things that stood out in the interview was, number one, you need the resources and support. They talked a little bit about the respite care, having in-home nurses, things like that. Sometimes that can be a challenge too, just depending on insurance and where you are. So just know that. Even though we know it's a benefit and it's a help, sometimes it's a challenge for people to be able to get that. So that's something to always think about too and to consider, as we know it's a benefit, but are they going to have to jump through hoops with some of the insurance companies in order to be able to get that support that they need? So again, making sure that we're sharing with our insurance companies how important it is to support caregivers, knowing that this is a relief, it's something that they really need to help them balance their own life, is really, really important and critical. I think one of the other commonalities that I loved, and this was a question that you asked to the panelists as well, the question that I asked them is, what do you love most, though, about being a caregiver? And I thought this was really, really powerful. They said being able to care for someone that you love, that you know that loves you, and also understanding that it's a benefit to that person that you love because they're not having to be cared for by someone that may not be next of kin, that may not be within their family circle. So they said that's the joy that they experienced in caregiving, is knowing that I'm caring for someone that I love, that this person loves me, and that I can be there for them versus someone else trying to do the work for me. So just thought that was really powerful. Wanted to share that, wanted to add that personal note. Hope that that was a benefit and a help to you all. As we talk about the resources, this is my last part of the talk, but as we talk about the resources, I'm going to share with you some organizations that are out there that can support you as a caregiver, that can also advocate for you as a caregiver, that can also give you the information and the resources too that you need to assist you in your caregiving. So we know again how valuable and how important that this is, to know that these resources do exist and that they are out there. Okay. The first organization is Family Caregiver Alliance. They offer information, support, and resources for caregivers. The next is the National Alliance on Mental Illness, and you all heard Alexis say that I am a member of NAMI, and I also serve in leadership for the National Alliance on Mental Illness. What I found to be very, very powerful at one of our former meetings that we just had, or recent meetings that we just had, I found out that we are currently working on a caregiver helpline which
All
will
right
be
now.
out very, very soon. So I'm so, so happy about that. So excited that I learned about that. So soon, NAMI will have a caregiver helpline where you can call to get support around resources and the things, hopefully, that you need to help you on your caregiving journey. Okay. Next organization is Caring Across Generations. They offer information, tools, and resources as well for caregivers. AARP, they offer resources and tools as well. Mental Health of America, they provide resources for caregivers and individuals with mental health conditions. And then the American Psychological Association, they also offer resources and information on caregiver mental health. So again, great, amazing organizations that are out there. Please, 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 I urge you, I prompt you to go to their websites, get their information, become members, reach out to them. And that's the end of my talk. So I do hope that all of this information was a benefit to you all. I know we have a little Q&A that we want to get done, but hopefully that was a help to you. And like I said, overall, complexity when it comes to mental health challenges, when it comes to sometimes obtaining resources for caregivers. But again, we know that the resources are essential. So please, please, please reach out to these organizations that offer it to you for free.
Thank you. I really, really appreciate that. I know that people oftentimes feel like they don't have anywhere to go or they're lost. It can be extremely difficult, as we've all heard, caregiving without having that additional support, not just from friends or family or that positive bunch that may come with a grandmother, but actual support. And I think it's fantastic that NAMI is going to have that caregiver helpline. And what we can do at the end of this, we'll see if we can include those links and names to share for people who might need those. And then we'll see if we can open it up, if there's any questions or comments for our panelists that we may have out there. And if there aren't, or if you're afraid, that's okay. But we'll take that time to ask any questions, or answer rather. Give it a couple minutes. Go ahead and scan that QR code. Yep, scan the QR code if you have any questions or comments. We're here for you. Okay. So again, what I'll do now is we'll close us out. If there aren't any questions, we will include those resources. I just wanted to take the time to just note that caregiving, there are rings to caregiving. Whether you're inpatient with your family circle, it's exhausting, it's frustrating, it can be difficult, and you might also discover that there's a deep sense of satisfaction, maybe. And if you don't, that's okay. There can or cannot be joy. There might be shared humor. I know I had a good laugh in regards to that toe comment. So, and just moments of family memories, and they might not always be good. Trust me, but I think it's very, very important that we have people doing excellent work to caregive for their families, because if no one else will, why not us? Why not us? So again, lean on your village. It can be hard to get organized and listen to yourself or reach out to support, but we're here. We will include those resources, and you're not alone. So I just wanted to say thank you to, oh, go ahead, Dr. Izzy.
Alexis, there's one question that popped up. It
Oh,
said
there is, okay.
From an employer standpoint, what would be good to offer for caregiver employees? What I would share is considering a caregiver support group. If you're not able to offer it at your organization, then definitely referring them out and making sure that there are resources that are available, such as like a resource list that you can share with those caregivers. And even, like I said, offering the opportunity for them to share about any current challenges that they may be having. Anyone else want to chime in on that?
I would just offer that having flexible time off policies that allow you the time to care for a family member or someone close to you. It's like one of the things that's been super helpful for me here at Marsh McLennan.
I agree. I can tell you there is no way that I would have been able to travel to Wyoming and work at my grandma's house 2 days a week had it not been for this amazing company. My director said, work is where the Wi-Fi is. So I absolutely agree. Having a flexible employment schedule, PTO, whatever that may be, is a godsend.
I
Only,
also agree. Go ahead, Fela.
yeah, the only other thing I would add is also making sure you train and empower your leaders, right? Especially leaders of people, because oftentimes when you're in these positions, your direct really relationship with your leader, right, can also have a very, very big impact on your experience while you're going through these things, right? So, I agree with all the comments, right? Having a flexible work arrangement, et cetera, right? But if you have someone that you're working directly with who really empathizes with what you're going through, is super flexible, right? And can help you through that, right? That's one less load that you kind of have to carry. So I think providing training and especially to leaders within your organization, I think is going to be really, really important to that piece too.
That's good. I would add like a training too on supporting them walk through sometimes the FMLA process, because sometimes individuals have to take that time off and it may be longer than a week. So they may need to go through the FMLA, and some individuals have difficulty navigating through that process and completing paperwork that surround it. So again, making sure that those policies are flexible around that and training those employees that are caregivers on how to walk through that process so that they don't have that as one other added stressor.
Yeah, that's a very good point. There is one question that kind of spoke to me. So I'd like to answer this. How do you navigate an elderly parent that you don't have a good relationship with? You love them because they're your parent, but you don't like them because it's toxic. I think one, that's a thing and it exists. So whoever asked that, I really appreciate it. And I'll speak to that because, as I mentioned, my mother has sickle cell disease. It impacts my whole family and it's very common amongst African Americans. She has sickle cell disease, my uncle, cousins, etc. And she is also battling depression, anxiety, bipolar, mood swings, but she doesn't believe it. Now that's a whole other conversation, but there's often times where she's had episodes and I've had to leave work, or she'll lash out at me because I'm not doing something for her. And I will just also list it's all about boundaries. Boundaries. It's you love that person and you do care for them, but do what you can with what you have. There is no rule book. There is no guide. I think as we've all heard, we're taking everything day by day. Yes, we do love them, but just I say do what you can. And I know that may not have been answered to what you wanted to hear, but that's what I'll have to say. Now we have a few other questions coming in. I'm not sure where we are on time, but if we don't get to every one of these, we can possibly have them answered by our panelists later. Possibly one, I do like this one. One more and then we'll close this out. What are some of the caregiving superpowers that you developed? Does anyone want to answer that quickly?
I love that one.
Yeah.
I have definitely taken we have no idea what everybody's going through on a day-to-day basis. We don't know what they have going on at home. We don't know what they have going on personally, emotionally, mental health wise. I know that in today's office culture, there's always drama, there's always things going on. And so one of the superpowers I have taken away is to always remember that I have to think about putting myself in their shoes, be understanding, be empathetic, and every feelings matter. Everybody's feelings matter. All feelings are valid, whether I think that they're overreacting or drama or whatever. People are allowed to feel those feelings, and I've really taken with me to just be empathetic with anybody and everybody around me.
That's a good point.
Well said. And I would add to that is your self-care is your superpower. Doing everything that you can to try to maintain balance, to try to take care of yourself, getting the help that you need, and again, the resources that you need so that you can take better care of yourself, because it's a myth when we think that we can take care of everyone else and leave ourselves for last. The only way you will be effective in helping or taking care of someone is if you know how to best take care of you.
Yes. You can't pour from an empty cup. I can't believe in that saying enough. And that's exactly what this is. We're navigating family, work, well-being, and more. So I just wanted to thank our panelists, our SME and mental health expert, Dr. Izzy, for everyone's insights, their stories, and willingness to participate. Thank you. And thank you to the audience for joining. Thank you to Dive In. Thank you to our committee team and everyone for making this happen. So have a great day, and we will hear from you soon. Bye.
Yeah.
Thank you.